Okay, so I chose diabetes mellitus. So the first thing that I think is important to know when understanding diabetes mellitus is knowing the difference between exocrine and endocrine. So the pancreas is actually an organ in your body that is both endocrine and exocrine. It's exocrine because it secretes different enzymes that are critical for digestion, but it's also endocrine because it releases the hormones such as insulin and glucagon, which regulate blood sugar. Um, it's important to know these hormones and where they're released because this can affect your understanding of diabetes mellitus. So insulin and glucagon. Insulin is a hormone that is released from the pancreas when blood sugar or blood glucose levels are too high. Glucose and sugar are kind of referred to as the same thing in the body. It is secreted by beta cells within the pancreas. So an example I put was in someone without diabetes, insulin will be released when glucose levels are not in their normal range. So like after you eat a meal or anything like that, insulin is going to be released because your glucose levels are kind of peaked and increased. Then this insulin, which is a hormone, goes to the muscle, fat, and liver cells within your body, and it tells them to absorb the glucose and use it for energy. And then it can also tell them to store it away, and then that's when it turns into glycogen. Without insulin, the cells will not be signaled, and therefore the glucose will not be absorbed. So I would say insulin kind of acts as like a key. If the key is not there, then the glucose won't be able to be absorbed because it's not signaling those cells to absorb it and use it. So glucagon is a hormone that is also released from the pancreas, but instead it's released by the alpha cells. It is released when blood sugar levels are low, so if you haven't eaten a while, or another example is when you need more glucose. So when you're exercising, you need more energy, so that's when you're going to need more glucose. So that's when glucagon's released. And glucagon can cause, it like goes to your, and it tells you that you're hungry, so then you're going to want to eat more as well. It also goes to the liver cells and tells them to release more glucose and also to break down the stored glucose, which, as I said, was also known as glycogen. So first one, diabetes mellitus I'm going to talk about is type 1. This is also known as insulin-dependent diabetes mellitus or juvenile diabetes because it usually peaks at the age of 12, and you usually see the signs at a very young age. And it's insulin-dependent because you're not producing any insulin at all, so you are going to need insulin therapy in order to live. Type 1 diabetes is most commonly an autoimmune disease. An autoimmune disease means that your body's immune system is attacking the healthy cells, and there's a lot more autoimmune diseases, but this is a very common one. In the case of type 1 patients, their immune system attacks and destroys the beta cells, and like I said in the last slide, beta cells are what release insulin and also amylin, which I will talk about in later slides. If the beta cells are destroyed, then there will be no secretion of insulin at all. And that is why it's called insulin dependent. So causes, like I said, it's an autoimmune disease. More rarely it is idiopathic, which means the cause is sometimes unknown. Signs and symptoms, you're going to see increased thirst, increased hunger, which is due to the increased levels of glucagon, and increased urination. Other possible signs and symptoms could include blurred vision, fatigue, and weight loss. Testing is fasting glucose and hemoglobin A1C. So basically you don't eat usually 24 hours before you do a blood test, and then that blood test will show your glucose levels. And usually you have to do them repeatedly and have a glucose level over 126 multiple times in order to be diagnosed as diabetic. So normal fasting glucose is less than 99, but for people with diabetes, their fasting glucose is actually going to be greater than 126. And then the second test, which is more commonly used because they're like you can't really cheat it, like with blood tests you can. So hemoglobin A1C is used because glucose sugar actually sticks to hemoglobin. So during the blood draw, they're going to look at your hemoglobin and they're going to look at your levels of hemoglobin A1C. So normal levels are less than 5.7%. And in people with diabetes mellitus, levels are actually going to be greater than 6.5%. And then for treatment, the most common treatment is aimed to maintaining those glucose levels by monitoring, insulin therapy, diet, and exercise. So I included here some ways that are commonly monitored when you have type 1 diabetes, and sometimes even type 2. So there's the traditional home glucose monitoring, which is not a lot of people's favorites because you have to prick your finger, and then the blood that comes out, you put that on a touch strip, and then your glucose levels will be read by the machine, and then it will be read on the screen. So this is something you're going to have to do like frequently to make sure your glucose levels are okay. And then another one, though, and there is a continuous monitoring, which I feel like is becoming more popular with newer technology. And this is usually used with an insulin pump. So it's a glucose monitor. It basically will like find trends in your glucose blood level patterns. And then an insulin pump, which in the picture, it's attached usually to your stomach. It pumps insulin continuously pumps insulin, or according to the patterns that the glucose monitor finds during the day. So usually that's the more common one because it's easier to, it's always constant and you don't have to worry so much. So next is type 2 diabetes mellitus, and it's also known as non-insulin dependent diabetes because you are still releasing insulin, but either you're releasing decreased amounts of insulin or like you're having down regulation with your receptors, so your receptors you're having a decrease of those. This differs from type 1 because, as I said, your body still has beta cells because your immune system isn't attacking it like it is in type 1. So you're still producing insulin, but just because of lifestyle choices, genetics, or even some medications, you're producing decreased levels or you have insulin resistance. Insulin resistance is because at first the beta cells, because you're having such continuous high levels of glucose in your blood, at first, you're going to have really high levels of insulin in order to keep up with the high levels of glucose, but over time, the beta cells kind of just get burnt out and they cannot keep up with the high glucose levels, and that's what leads to the resistance or decreased production. So pathological changes, so islet cell burnout leads to a decrease in insulin production. So basically, because of the how much glucose you have, the cells just burn out, they cannot produce any more insulin because they've gone so long with producing such high levels, they're just burnt out. Your amylin levels decrease. So amylin is also secreted by your beta cells. So they're secreted by the same cells that release insulin. So if you're not releasing insulin, you're not really going to release amylin either because those cells are burnt out. burnt out, and the amylin suppresses glucagon release. Your glucagon, because of the amylin is decreased, you're going to have an increase of glucagon levels, and then you're going to have a decrease of insulin receptors, which is also known as downregulation. Your liver will release excess glucose and have more breakdown of glycogen due to the increase of glucagon levels. Because the glucagon then goes to the liver and says, we need more glucose, and then so that your liver will think it needs to release excess or break down the glycogen, which is stored glucose. And then you're also going to have the renal absorption, an increase of renal absorption of glucose, and that's why you're going to be having increased urination. So, causes usually caused by lifestyle choices such as diet, exercise, or smoking. It can also be caused by genetics. It is actually being seen to run in families a lot, or different medications can cause it as well. The most common symptoms are increased thirst, urination, and hunger. Other signs include acanthosis nigricans, which is darkening of the skin around the neck and armpits. I have the picture right there, so it's due to an increase of like melanin production. So you're going to have darkening around the neck, folds, and then also in the armpit area as well. And then you can also sometimes see skin tags, obesity, and yeah. And then testing is the same as type 1. You're going to look at do the blood fasting glucose test, and then you can also do the hemoglobin A1C as well, and those levels were in that slide. And then treatment is usually a healthier diet, exercise, insulin therapy, and medications. Oftentimes, if the patient follows a strict diet plan and exercise routine recommended by their doctor, the diabetes could actually go away as long as they stick to a really good plan and they follow that. So gestational diabetes, this is caused by pregnancy. It doesn't necessarily mean that you had diabetes before you were pregnant, but during the pregnancy you were diagnosed with very high blood glucose levels. The cause is still not for sure according to the American Diabetes Association, I believe. But it is believed due to clues that it's caused due to the hormones released by the placenta. Those hormones keep the baby alive and healthy, but they also unfortunately block the action of the mother's insulin in the body. So this is what causes the insulin resistance in mothers during pregnancy. And I believe that it's like 9.8% of pregnant women get gestational diabetes. Signs and symptoms, usually no symptoms at all. They could have the increased urination, thirst, and hunger, but usually they don't show symptoms, and they find out during their blood sugar test when they go to the doctor. And then testing, there's the glucose tolerance test. This involves drinking a liquid that has high levels of glucose in it, and then your blood sugar will be tested before and after to see how your body handled and tolerated the glucose. So, if after you drank the beverage, your glucose levels were normal after about like an hour or two, then you don't have the gestational diabetes because you're releasing enough insulin. But if your glucose levels kind of remain the same, that means you're not absorbing that glucose for energy. And then treatment is usually a healthy diet, daily monitoring, and exercise. But if the blood sugar is still too high, then medications may be needed. And then here's my reference page. So I used mostly the PowerPoints from class, and I also referred to American Diabetes Association website for every single type. So type 1, type 2, and gestational. So that's it. Bye.